Several residents in Congressional District 14 came to the Twinsburg office for Congressman David Joyce to express their concerns about the proposed health care law designed to replace the 2010 Affordable Care Act. The bill was scheduled to be voted on The residents who came to the congressman's office shared their personal stories about how the new law could impact them.
So we have a small business, and I would like to say that they keep saying that the premiums are going up, but we've been in business 30 years, and our premiums were going up at a faster rate before the Affordable Care Act than now. So it's always been the case that premiums have gone up, but now they're going up because of the protections that came in and the requirements that are under the ACA. They are going up at a lower rate. So I feel that that talking point is not a correct talking point. It needs to be corrected.
And we've been in business over 30 years, so we have a long history of dealing with it.
Okay.
The same thing, that yes, insurance goes up, but my insurance cost twice as much before the ACA went in. It was a godsend because it was approaching more than 20% of my income. It was very hard to stay in business with health care that high. And now, we're back to where they can charge women more, they can charge elderly 5 times as much. I'm a cancer survivor. I've got all kinds of pre-existing joint conditions. My medicines alone are going to drive the cost to where, within just a short time I'll have to start doing what I need to save. So this is a disaster for me. This is just going to take me down after 35 years of providing other people jobs. I started working when I was 15 years old. I did all the things you're supposed to do, and now this is what's going to cut me off at the knees.
And many of them are my constituents from my ward and have grave concerns about coverage for women that is going to be stripped out of this new bill. So I can bring you their concerns today. And then on a personal note, my mother suffers from MS and has incredibly expensive medications. My dad runs a nonprofit organization, so the only way they are getting coverage is through the Affordable Care Act now. They have no idea what they're going to do for her medication if the law's repealed.
Betsy Rader, an attorney for employment issues, describes what she feels could happen to someone who has lost their job.
And so they lose their health coverage at a stressful time. They can't go get mental health care that they need because they don't have health coverage. And now, under this act, they're going to be penalized. They've got no income. And so how are they going to buy insurance? So if they let their coverage lapse, then we're going to penalize them and charge them a surcharge to get back onto coverage again. And chances are, even if they get another job and they're able to afford coverage again, they're not going to have, they're going to have already exhausted their savings by then, most likely, and they're not going to be able to pay a surcharge. It's a massive shift from the poor to the wealthy. We're giving huge tax cuts and sacrificing all of these hard-working Ohioans.